Welcome to another episode of the Clinical Career Collective S.O.A.P News. For those of you who are new to us and our mission, C3 is a professional development community for the mental health professional at large. We are here to support you so that you can learn, advance, and become the clinician the world needs now. You can find us at our website, www.clinicalcareercollective.com, on our YouTube channel, S.O.A.P News, and of course, we are extending an invitation to join our C3 Facebook page at Clinical2 Professional and our LinkedIn specialty page at Clinical Career Collective. Today's SOAP note will cover the topics of dangers of digital health. We will go over some examples of these hazards and describe how they are impacting the lives of consumers, patients, and healthcare workers. And finally, we will share some suggestions and tips for how you can better prepare for these new advancements and the issues that come. I'm Amity Cooper, your host and creator of the SOAP News. As a trained clinician, I really benefited from applying the SOAP note method in my practice. So when I started C3, I thought it would be a really fun way to craft a blog series that incorporated the same principles as the handy SOAP note. What better way to get updates, tips, inspiration, and reviews about relevant, on-point clinical and business topics affecting our industry today. Advancements in technology have brought healthcare into the 21st century in many ways. They have made treatment more accessible and affordable. Digital health has driven breakthroughs, eradicated deadly diseases, and made other diseases more manageable. All of these beneficial developments, there are, of course, some negative consequences to navigate as well. Today, we're going to talk about these digital health hazards such as bioterrorism, biased AI, and the concerns about confidentiality and our loss of privacy as the technology gets better and becomes more integrated into our daily lives. Advances in digital health require a critical eye. Let's begin by going over the top 10 dangers that we need to be aware of when we examine these new technologies in the medical field. Number 1, much of the gathered medical data that adaptive AI relies on is full of inherent biases which lead to misinformed results. Number 2, a second concern is wireless connectivity. It makes our lives so much more easier, but it also exposes us to remote hacking. There are a number of trade-offs with incorporating digital health services into our lives. Is it ethical for these companies to have access to this raw data? Health centers and AI software collect our personal information to generate personalized and individualized results. We sacrifice some of our privacy for the benefit of monitoring our health. Consumer protection agencies and the public have questions surrounding what these companies are doing with our data. How are they protecting our information that we are willingly sharing? Number 4, the fourth and most common cyber threat to healthcare is ransomware. This is when a hacker holds an organization's entire IT system captive using a virus until a ransom is paid. And this isn't just immune to organizations. I mean, this is becoming more and more of a common threat to individuals. I've heard of many acquaintances who have unfortunately experienced this, and it's quite scary and annoying, and just it feels like an invasion of privacy. So this is real, and it's very, very active today. Number 5, even though all of these great technological advances help patients get greater access to medical tools and information online, incorrect self-diagnosis and unnecessary hospital visits have increased. Number 6, maybe you've heard of this threat, bioterrorism. A biological attack, or bioterrorism, is an intentional release of viruses, bacteria, or other germs that can sicken or kill people, livestock, or crops. The government and CDC are constantly monitoring these threat levels across the globe. The fear is that if it's gotten into the wrong hands, hackers or any other non-friendly entity will try to remotely control our health and our lives. Number 7. The 7th issue is the disparity between AI development in laboratory settings and its use in real-life clinics. There are inherent biases and risks associated with this kind of new technology that researchers are still grappling with. Current conditions are far less reliable or ideal. Number 8. Electronic medical records, their systems are behind. Most software systems are still not able to sync with patient-obtained digital health data. There is a disconnect between patients and doctors, and even with all these available tools and technology, there's still these issues. It's more of an inconvenience today. We see a lot of physicians and even, behavioral health clinicians who have moved online and are using these customer relation digital management systems, but it's not always syncing properly. It can get a little wonky. Number 9, the use of facial recognition technology, specifically in hospitals, is a software that can identify someone based on their unique facial features. This sounds like it's out of a science fiction movie or novel, but facial recognition software can now identify rare genetic conditions to mood symptomology. The question is, are we starting to cross the line, or are we improving upon what the human eye can't see? Number 10. The 10th and final danger on our list is the access that health insurance will have to consumers' personalized data via their data trackers. There are a number of positives to syncing your health data with your insurance company, like easier treatment, preventative interventions, possibly cheaper care. The downsides are customers might be discriminated against based on their perceived genetic risk factors, or they might be obligated to provide data from their health sensor or fitness tracker when qualifying for insurance. Fitbit, in partnership with Qualcomm, created a $10 million prize for companies who could develop a sensor to develop a specific type of multifunction medical device. So this is really in the works. That prize was sort of announced a couple of years ago. I'm not sure actually who has won, but the question and the jury is still out. Does our information age, data tracking, quantified self make us more susceptible to hackers and greedy companies, or does it allow us to truly design from the inside out our health? How do these digital dangers impact the field of healthcare and the patients we serve? Threats like remote hacking over Bluetooth are possible. Although these threats are minimal, they are plausible. And according to Dr. Jeff Tully, an anesthesiologist resident at the University of California, Davis, whose mission is to bring awareness to these growing digitalization risks, says implantable devices live in an ecosystem that are all connected, and any part of that network that is vulnerable to attacks makes the network vulnerable as well. Ransomware attacks can shut down entire institutions, disconnect the internet, disrupt operations and clinical appointments, and divert patients from receiving necessary emergency interventions. By the end of 2020, there was a 45% increase in cyber attacks on healthcare organizations around the world. We can see that our world is becoming more intertwined and interconnected. How we proceed will take caution, thoughtfulness, and care. We're entering new territory, and as we adjust to these new advancements, our ethical decision-making skills are maybe wanting. We need to have real, open, and honest dialogue about our next steps. We know that companies manufacturing healthcare tools have access to customer data and privacy. It's just not always guaranteed. However, it becomes unethical and a breach of privacy when companies like Clearview AI, who pitched its platform to track those infected with SARS, used unsuspecting social media users' pictures to create its facial recognition database without their users' consent. When used for good, this type of technology can interpret patterns to reveal different medical conditions. In the wrong hands, racial discrimination, clinical and medical misdiagnoses, hacking, and misinterpreted biases may arise. So just because you can Google something doesn't mean the information retrieved is correct. The lesson here is searcher and digital user beware. Using the plethora of digital tools and technology available, patients can Google their symptoms and wrongly associate the online results with a more serious condition that a caregiver might diagnose differently. Right now, smartwatches are limited. They're great for tracking or resting heart rates, but alerting consumers about their abnormal ECG readings might be a stretch. What kind of regulations and checkpoints do we as consumers and users need to put into place to protect ourselves? As we watch the drama of the Theranos Elizabeth Holmes unfolding, I think it bears more analysis. Does the promise of streamlined digital care come at a cost that we might not be ready to pay? Do these advancements get in the way of good quality data and interfere with a healthcare provider's ability to serve and care for their clients and or patients? They're all really good questions. So what can we do to promote equity and safety as technology continues to grow and become a more ever-present part of our daily life? In order to fulfill the demands for security for our patients and clients, medical and behavioral professionals should be made aware of the inherent risks and challenges related to the incorporation of new technology. How can we ensure that wearable devices connected to our physiological system will be protected from remote attacks? Patients needing to demand safer options, and developer companies must make sure that the devices they are creating are as secure as possible. The use of facial recognition software in the healthcare field brings new possibilities for diagnosing and preventative interventions. However, the technology still poses risks of privacy and racial discrimination. The healthcare community should demand more research and monitorization. This also goes for adaptive AI. As for more advanced technologies make their way into the digital health field, healthcare stakeholders must stand up for the privacy of their consumers. The U.S. Genetic Information Non-Discrimination Act was put into place to protect health insurance consumers against biases, but as technology advances, we need to continue to support advancement in the laws and regulations protecting our clients. We need continued efforts to streamline our electronic medical record systems so that they can be accessible to everyone. And to avoid misinterpretation and self-medication, medical professionals should educate patients so they can correctly read their smart sensors. The data available to patients should have clear guidelines and instructions. Company literature should provide a clear outline explaining their product's limits and benefits of service. And as practitioners, you can do your part. You can educate your patients and clients about these issues as they arise, reviewing the risks and benefits with them of these new technological device tools. If you want to read more information or pursue some of our research, I provided a couple of links here to some articles that we used when we were investigating and researching this topic. So I'll make that available to you in the show notes. Lastly, if you are interested in learning more about the new and cutting-edge technologies affecting mental health practices today, then I'd like to invite you to register for our monthly S.O.A.P newsletter. With this subscription, you will receive a monthly review of all the weekly S.O.A.P notes, gain access to members-only interviews, and conversations with special guest speakers. And you'll have the chance to purchase our monthly S.O.A.P box that contains products, coupons, and discounts to all our mentioned items reviewed during the S.O.A.P note recordings. Thank you so much for spending some time with me. I hope you've enjoyed this and it was informative. I'll see you next time. Take care.